Welcome to everyone who is joining us today. This is certainly a serious time that we all need to be thinking about very hard. I just pulled information about the extent of illness related to COVID-19 around the world, and we're more than 360,000 cases around the world, and deaths have topped 15,000. China still leads with the most cases, but we are also seeing a lot of cases in Italy, and the U.S. has moved up into the number 3 position. Not something that anyone wants to be part of, but we are. And the good news is, though, there are things that we can do to help us get through it, but it is going to take a while. Let's think about some general infection prevention guidelines that can help to avert an illness of COVID-19 as well as other illnesses, because for those of us, certainly in the food service realm, we can't stop doing our standard safety practices as well. But firstly is staying informed, especially with COVID-19. There is a lot of information coming at us all the time, and it's very important to follow your local public health recommendations related to what may be going on in your particular cities and towns and states, because it is variable and it is changing. Next, we need to make sure and continue to make sure that we're implementing good infection prevention practices. Reinforcing personal hygiene is something that we will talk about a lot through this webinar, and it's very, very important. Making sure that the right materials are available so that your employees can practice good hygiene, and then making sure you have the right disinfectant products available as well and following their protocols for use. You also need to communicate with employees and monitor their health, making sure they're educated about this ever-changing situation and encouraging symptomatic employees to stay home. Now, we always put this disclaimer at the beginning of these kinds of webinars simply because of the fact that this information is changing. So we always reference current information from the U.S. Centers for Disease Control, or CDC, and the World Health Organization, and we supplement it with what we know as well. But for the most up-to-date information, please refer to these public health authorities for more information. But increasingly, state public health departments are also providing lots and lots of very specific kinds of information. And you can certainly reach out to Ecolab for additional questions on products and procedures. So protecting yourself, your employees, and customers is really focused in on these standard infection control practices, training your employees on how to use them, and then making sure that everyone is compliant. Now, it's very important, again, that hand hygiene is practiced, and that's why we have 3 different pictures of here illustrating that this is so important. We also illustrate a couple pictures related to surface disinfection. And the good news is that coronavirus is what's called an enveloped virus. And enveloped viruses relates to its structure. And the good news is that these are the least resistant to disinfection, which means that disinfectants that we would commonly have available can be used to effectively kill coronavirus on surfaces. We'll talk through what this means practically. But thinking about protecting ourselves, we know there are no vaccines available to protect any of us against this human coronavirus infection. But we can do things to reduce our risk of infection by doing the following. Guess what? Washing our hands often and correctly. And the World Health Organization does recommend that hand hygiene with soap and water is certainly the #1 strategy, but alcohol-based hand sanitizer can be used if soap and water are not available. Now, with the reality of shortages of hand sanitizer around the world, we can't forget the importance and the real utility of soap and water. Second, we need to avoid touching our mucous membranes with unwashed hands, as this is the route that the virus particles will get into us. We need to certainly avoid contact with people who are sick, and avoid areas where live animals are being sold or raised, especially in regions where there's excessive cases being reported. This is related to the fact that the origin of the virus seems to be from a wild animal market in China. We don't know where these coronaviruses might be within the live animal kingdom, so we need to be very careful in staying away from them. Also, wearing a mask may be recommended, but we need to seek medical advice on when to do this and tell the doctor if you've traveled and what you have been exposed. Protecting others really just takes these same recommendations and flips them around. If you have cold-like symptoms, you can help protect others by doing the following. Wearing a mask if it's advised by healthcare experts, but we certainly have heard that there are significant mask shortages for our healthcare workers. So we really need to follow advice from these experts to tell us what to do related to this. Staying home when we're sick is crucial. Avoiding close contact with others is also very important. To date, this has been defined as maintaining a distance of 6 feet between each of us. Washing our hands. Again, I can't emphasize that more. Covering our mouth and nose, seeking medical advice, and cleaning and disinfecting. We've developed a series of procedures based on a so-called risk profile, and we recommend that you take these steps based on what your risk profile may be in your particular operation. We've informed this from guidance from public health reports and how we understand the scientific characteristics of what's causing this outbreak. Now, it would be nice if we were all in the green zone where there's really no risk, no known outbreak in your geographic area, just following standard procedures and so on is very important. But I think it's fair to say that we're not in the green zone anymore. There may be some places in North America where we are in the yellow area where there's a potential for an outbreak in your geographic area. If we believe we are there, educating employees is really important so that they're prepared for what they need to do. Also assessing your own preparedness status and collaborating with the right vendor partners on how to be ready. Making sure that you have the right products available within your facilities. Think about what that may mean for ordering, etc. And then generally increasing frequency of standard procedures is recommended. In a red situation, this is when there's been a publicly declared outbreak in your facility or region that is disrupting normal business. I think this is true, frankly, for most of the U.S. But there may be situations, again, where you're sort of between a yellow and a red. But regardless, in the red, what you want to do is enhance your procedures to be able to respond to the fact that there may be an outbreak in your facility due to an ill employee, for example, and you really need to work to break the chain of infection. You need to make sure there's training available and has been delivered, performing these procedures using the right products, and then planning for deep cleaning and reopening procedures at the right time. So thinking about hand hygiene, again, we need to put a lot of emphasis on this. So wetting our hands with water is the first step. Dispensing soap into our hands and lathering all over the fronts, the backs, between our fingers, under our nails, making sure we get the thumbs, etc. Scrubbing for at least 20 seconds, and we've heard many commentaries related to singing certain songs like Happy Birthday twice, but you may find something else that would be just as good. Then rinsing our hands under clean running water, drying our hands using a clean towel or air dryer. And then ideally using a towel to turn off the tap so that you're not recontaminating yourself. The cleaning and disinfection of hard surfaces and high-touch objects will be very important as well. And it's key that you use approved disinfectants. you want to be increasing the frequency of these actions as needed. And the basic steps are to pre-clean the site. That is to remove any visible soil on those areas that need to be disinfected. Then using the right product. Because this is an emerging viral pathogen that we haven't seen before, EPA has allowed us to make so-called emerging viral pathogen or coronavirus claims. And it's very important to refer to the product label for complete directions on use. And we'll talk about how we can find a list of approved products. After the disinfectant is applied, it's very important to allow the surface to remain wet for the time that's indicated in the directions for use that you find on the product's label. And then dry the surface or allow it to air dry only after the right amount of dwell time has been achieved. So how can we tell if certain disinfectants are approved for use against this novel coronavirus? So certainly working with your sanitation provider is a great way, but there are other lists out there that you can refer to. One of them is called the EPA registered antimicrobial products for use against novel coronavirus. I know that's a mouthful, but that is what it's called. And when you pull that list up, and I know you can't see it, but you will get a spreadsheet as is shown on the right-hand side of this slide. And what you want to do is in that first column, match the first two parts of the EPA registration number against the label that you would have on a product in your facility. On the left-hand side is an example of one of your products. On every registered product that's registered by EPA, you will find, as is stated in this red box here, the so-called EPA registration number. And you could see in this case, the example is the number of 1677-235, which connote the base registrant company number and the product number. It's those sets of numbers that you can find on that list from the EPA to confirm that your products are indeed on that list. Now, what do we do once we identify the right products? There's a series of slides here I want to go through about what to do in different areas of your facility in order to, again, lessen your risks. And we've set these up by different areas of your facility, starting off first with so-called public areas, things like lobbies, entrances, and hallways. You can see what the standard procedures are, and you should be following these or should have been following these because this is just what you are doing. In a remediation or a red zone, which is really where we are, it's really recommended to continue following these procedures. Note that they do include cleaning and disinfection of hard surfaces, especially high-touch surfaces. And looking down in the lower right-hand corner of this slide, we see a listing of some of these as examples: door handles, push plates on doors, drinking fountains, hand railings, tables and chairs, things where people would be handling things. The handles on vending machines, for example, or ice machines, telephones, keypads, those kinds of things. Things to keep in mind is to make sure the right personal protective equipment are available, maybe gloves, for example, as is directed by your public health authorities. Certainly increasing cleaning and disinfection of these high-touch surfaces makes a lot of sense. And consider limiting access to those vendors and others who might be non-essential, and certainly restricting entry of anyone who is showing symptoms or those who have been exposed. And again, following guidance from your local public health authorities, because this is changing pretty rapidly these days. Well, what about food safety? Well, the good news is that there continues to be no evidence that COVID-19 is transmitted to humans through food. And keep in mind that this outbreak has been going on for almost 3 complete months, as things did start in China. So we have a fair bit of history on this, and there remains no evidence of transmission through food. But we can't forget about standard food safety practices, certainly related to handling of raw or uncooked animal products, avoiding cross-contamination, handling of any raw products that might be contaminated, and then properly cleaning and sanitizing contact surfaces, including any utensils in our hands. What this means then for food contact surfaces, again, if we look at the touch points down in the lower right-hand corner, things like cutting boards and knives and plates and glassware, handles, and so on that you may be coming across in your facilities, is the recommendation remains to follow standard washing or cleaning, rinsing to get any soil away, and then using a food contact safe sanitizer according to label directions, or following standard operating procedures in the dish machine. In a red situation on food contact surfaces, the recommendations remain the same, but you may choose to wash these surfaces and equipment on a more frequent basis and changing out utensils in a buffet line on a more frequent basis. But I have seen a lot of warnings in the last several days relating to closing of buffet lines. So again, monitoring local public health is important. The considerations remain the same as far as keeping track and making sure you're using the right and needed personal protective equipment, reinforcing personal hygiene. But there may be a situation where you would need to consider adding a disinfection step using, again, one of these disinfectants that we talked about previously. This might be a situation if there were an infected person working in your kitchen, for example, or someone was identified to be carrying COVID-19. In this case, you could use a disinfection step as stated, but because these procedures or these products rather are not approved for use on food contact surfaces, you would need to go back and follow the standard procedures, that is following a wash, rinse, and sanitize in a sink or in a dish machine after you applied that disinfectant so that those surfaces would remain safe for use. Non-food contact surfaces, though, we can implement use of a disinfection step because these surfaces are not going to be touched by food that then someone would eat. So cleaning those surfaces and then using a disinfectant, one of those products that we talked about, following the label directions, letting that surface dry as stated. In a red situation, you may want to increase the frequency that you're using these disinfection procedures. Again, the considerations remain the same, especially focusing in on high-touch, hard surfaces, and some of these are listed on the slide here. Many that we've talked about in the past, like handles, your cash register, handles of equipment, and so on, and the like. Cleaning and disinfecting in your restroom, frankly, is pretty similar to what you would be doing on non-food contact, but making sure that you are doing effective cleaning, using the right disinfectant product, following its procedures, and especially focusing in on high touch point surfaces. But certainly within a restroom, you need to think about those other standard practices that you follow. You know, making sure the trash is empty, that supplies are restocked as available, scrubbing out those toilets and urinals, etc. And then think about the same considerations, making sure you have the right PPE, that hand soap is available, and following public health guidance. And the touch points in a restroom are what we would expect, door handles and faucets and baby changing stations, hand dryers, and the like. We also in these times certainly need to be thinking about our employees. So in these times, we just need to apply the same guidance to everyone we're with. So reinforcing personal hygiene and sneeze and cough etiquette, for example, closely monitoring the health of your employees and encourage anyone who's showing any symptoms to stay home per your company illness policies. Identifying those staff members and functions who are critical, and make sure you have a business continuity plan, especially if all of a sudden you need to close down your facility and maybe only offer takeout service. Consider the ability for employees to work from home as appropriate, making sure hygiene materials are available. Make sure employees disinfect all personal hard surfaces as referenced on the product label, and always make sure they are educated about what's going on and what they need to be doing. So as a quick checklist here, basically 4 things. Make sure your team knows to stay home if they're ill with any kind of symptoms that might be related to COVID-19 or really anything else. Make sure they contact you if they were exposed to someone who's confirmed to have COVID-19, or they might reside in a restricted area or have a family member. Make sure your team knows that they need to limit exposure by avoiding large gatherings that they may come across in their personal lives, and certainly avoiding close contact with people who are actively sick. And then your team needs to know how to keep the business operational during any shutdown or quarantine that might be put in place, following whatever business continuity plans you have in place, and to make sure that regular cleaning and disinfection continues to occur. And with that, I again thank you for joining us, and we have some time for questions. And I will ask my colleagues to chime in and tell me what those questions are. I'm happy to address these, and I will reiterate what the producer said at the top of the hour, that you need to type your questions into the Q&A panel on the right-hand side of your screen.
Yes. And this is Nicole. I have a few questions for you coming in through the Q&A panel, Ruth. The first one is to clarify, how long does COVID-19 survive on surfaces?
You know, that's a really good question. And we have some data, preliminary data, that has been generated, but we need to keep in mind that this is a new virus, and it's only been in literally the last week or so that some data has been available. It's not extremely extensive, but we do know, for example, their results demonstrated survivability of the virus that causes COVID-19 for 2 to 3 days on stainless steel and plastic surfaces, but far fewer hours on cardboard surfaces. And that's all they studied. The other thing to keep in mind, though, is that, again, this outbreak has been going on for nearly 3 months, and to date, there is no evidence of transmission from surfaces to people. So while there certainly is a theoretical risk, and the data that I just shared can reflect that, we need to think about what this means from a practical standpoint. And if you'll allow me to get graphic here, if you can imagine someone who is shedding the virus, and again, this is a respiratory virus, so it's in our cough droplets and sneeze droplets and so on. Imagine someone sneezing, a droplet gets on a surface, it's small and it remains wet for a short amount of time. But someone comes along, picks up that droplet, say on their finger, and while that is still wet, they touch their eyes or they touch their nose or their mouth. That's what it would take for transmission to occur. Certainly, it is theoretically possible, but we really need to keep in mind that most of the transmission and the actual illnesses that we're seeing are related to clusters, both in healthcare settings and in households, or these very, very close contacts. So this is why all of us need to practice these standard infection prevention strategies of hand hygiene, again, washing our hands for that 20-second time period, practicing social distancing, and thinking about normal cleaning and disinfection, especially of high-touch sites, to help minimize the risk.
Great. And just an extension of that, I did see another question on the surface. Is there any clarity around how long COVID-19 survives on fabric?
No, there's been no work done, but we know from other coronaviruses, and there are many that can cause other kinds of illness, that generally transmission from cloth surfaces like bedding from a hotel room, for example, or even from a patient room, there has just not been evidence of transmission from those surfaces. There certainly are recommendations, and if we just think practically, if we are handling a lot of cloths or sheets or towels or tablecloths or whatever, making sure not to like hug them or kind of, lift them around so that any particles that would be there would be sort of aerosolized, being very purposeful and trying to minimize the potential transmission of something that could be there to others. But then even the CDC, and I, in fact, just looked at this morning, still recommends standard laundry procedures for cloth items, and that they believe is effective at controlling transmission.
Great. And I just want to reiterate, we're getting a lot of questions in the Q&A, so we'll do our best to go through all of them, or I'll try to summarize them as best I can. But one of the common questions we're getting is the availability of the presentation after the call. And our producer will jump on and say this as well, but we hope to send a link of the recording within a day or so of this event as well, just so you know. Another question we're getting is around quat. It sounds like there's a quat-based food service hand sanitizer, and then another question around like quat ammonia sanitizers, and just understanding a little bit more around the effectiveness around those. So could you talk a little bit about that?
Yeah, although I will defer to my colleagues on the Ecolab sales side to help recommend the specific products that would be recommended in those different categories. On the hard surface sanitizers, though, it is possible, following that guidance that I showed, back slide, again, looking and comparing the registration, the EPA registration number that you can find on any bottle of or any container of a sanitizer to the EPA list to learn which of those have been deemed acceptable. Again, EPA is allowing basically because coronavirus is relatively easy to kill. If such a product has a claim against a harder to kill kind of virus, they essentially bridge to say that then it will work against this easier to kill coronavirus that's causing COVID-19. So checking out this EPA list is helpful, but also reaching out to your Ecolab salesperson can help with that. Related to hand sanitizers, the guidance from both the CDC and the World Health Organization has focused in on alcohol-based hand sanitizers. So it's important to follow that advice. But also remember that both of these organizations always start their hand hygiene recommendations with use of soap and water as the first line of defense. So let's try to follow that and don't lose sight of the fact that good old soap and water is very effective.
Yes. Another common thread that I'm noticing in the Q&A is around employees. Mm-hmm. So not only what to do if an employee tests positive, but also having employees that have traveled either to another city or internationally. They're curious about mandated isolations or self-isolations, and then just wanting to make sure that employee safety is a priority.
Absolutely, yes. It it has to be. This is one where following the local public health guidance is very, very important, and how it applies to your particular situation. I think I'll give an opinion that I think it's reasonable that certainly someone traveling rather from a international destination that are known to have high numbers of cases, Italy, for example, or China, it would be reasonable to ask them to basically self-isolate and not come into the facility for a period of 14 days. And the 14 days is because that is the so-called incubation time, the time within which illness is likely to appear if someone has been exposed and is susceptible. As far as travel from, say, another state or another city, that's where guidance from your local public health authority is important. And I've not, as far as I know, seen guidance on limiting that, although I am certainly not up to date on every single jurisdiction's and state's requirements. So very, very important to follow your state's public health guidance.
Yes. Great. I see another question that has come in specific to laundry services. And then another protocol question for guest rooms. So are there any specific considerations or cleaning protocols needed for laundry service or laundry process? And then that same question in relation to guest rooms.
Okay. For laundry, really there's nothing different than what you would do under normal circumstances. But as I stated before, minimizing procedures that could spread any virus particles are reasonable to think about. So again, not like hugging a bunch of sheets in your arms, for example. Putting them into a laundry bag is one way to kind of contain them, or not shaking them out, when you're removing them from a bed and so on. So just being purposeful, I think, about minimizing that risk, but then following normal laundry procedures, through normal washing and so on, are fine per the CDC. For guest rooms, honestly, it's rather similar to what we would think about for the restroom procedures or those non-food contact surface procedures that I went through, thinking about disinfection of those high touch point sites, just thinking about where those guests would have touched, light switches, the remote control, the handle on the door into the bathroom, maybe that bedside table, the phone, light fixtures, and so on. Really paying attention to those in the normal kind of, turning over of a guest room. If you learn that there had been a symptomatic guest in a room, if there is a way to delay cleaning of that room, I've heard that as a recommended procedure, and that seems reasonable if it's possible. You would know that. If you're aware, for example, that someone is checking out and they are symptomatic, if you can delay cleaning that room for, again, 24 hours, that seems like that would be a reasonable practice. I understand that may not always be possible, but that could be a practice to follow.
Great. I also have a couple of questions regarding temperature. So there's one specific to a dish machine asking around a high temperature dish machine at 180 degrees Fahrenheit kill the virus, but then there's also a handful of other questions around if there's a certain temperature that kills the virus.
Yeah. Generally, high temp machines are fine. Again, following standard warewashing practices are very, very effective. I'm not aware of kind of a threshold of temperature. So following the guidance from our public health friends is that standard dishwashing procedures, but following them explicitly. So making sure that the wares are cleaned effectively, that, obviously food soil is removed, that they're stacked into the racks appropriately, not overloaded, that there's the right amount of detergent available, and that the dispensers are working, that the sump is cleaned out the way it needs to be, that the temperature is really being attained. These, just to make sure your machine is working properly, would be very important at this point. And then thinking about disinfection of those high touch point areas, like the handles on the dish machine, especially on the loading of the dirty wares side of that machine.
Great. And then just a couple more here that I want to make sure we ask, and if we can't get to all of them, we'll find a way to try to follow up with maybe an FAQ to this list as well. But there was a question specific to if there's any information around how long food service or takeout or delivery, I think we're all getting those personal calls to support our communities. Will they be allowed to open, or if there's any further instruction from the federal level regarding food delivery or takeout?
Yeah, what I'm seeing here is definitely a state by state differences depending on the risks that may be seen in those states. I'm here in Minnesota, and our governor, for example, about 5 days ago, I believe, or so, ordered that you can't eat any food on a premises in a food service establishment. And this extended to where there might be, a little seating area, say in a grocery store or in another kind of facility. Basically, you can't eat anything on site in a facility. And that did extend to hotels that might have had breakfast areas. They could still prepare food and serve it to guests, but people needed to take it away from those gathering areas. The whole trick is to avoid groups of people. In our case, I think it was less than 10 people. But regardless, that's what it is for Minnesota. You still can get takeout. You still can go through a drive-through or have food delivered. You just can't eat it in the particular facility in a group. How that might differ in other locales is really important to monitor what your particular states are saying.
Absolutely. And then there is a common theme around if COVID-19 stays in the air for a period of time, 3 hours after droplets are released, can it be transmitted by breathing in that air? And a similar question regarding the successful use of face masks and if they truly work.
Sure. First of all, the survivability in air. Well, again, it's a new virus. There's some data showing that it can remain in air, but it tends to be pretty localized. So the recommendations around maintaining this 6-foot distance from other people is quite reasonable. And that has been the recommendation, and it's true, and a similar figure is being used around the world. So I do put a lot of faith in that number, and I think it's reasonable. The other thing is that as we think about the definition of so-called close contact, basically it's being within 6 feet of another person for a period of 15 minutes or longer. It's believed that it takes, again, very close contact, so less than 6 feet, and for more than 15 minutes for transmission to occur. So sort of casual, walking past someone on a street, for example, is not a route of transmission that is being seen routinely. So I think we need to keep in mind the practical recommendations that our public health authorities are making have been based on their review of how cases have been transmitted. And I think that's face masks. Well, clearly there are not enough face masks for the people who are at highest risk. And this includes healthcare workers. And if we just think about the nature of a healthcare worker, who certainly would be within this 6-foot distance for theoretically a period of longer than 15 minutes as they're caring for their patients. It is crucially important that we provide face masks to this really high-risk population because we need them to stay healthy so that they can keep the rest of us healthy or manage us if we do become sick. We need to reserve face masks for use by healthcare workers. That said, there are other recommendations that if masks are available and if you become symptomatic and need to go into a healthcare facility, that wearing a mask to prevent your transmitting the virus from yourself to others, like that healthcare worker, may have some value. But it's really in these just two situations where face masks should be used. And just anecdotally here in Minnesota, we had a call over the weekend for just ordinary citizens if they had masks, especially N95 masks in their homes. Sometimes they're used in woodworking, for example, to prevent inhaling dust or solvents. The Minnesota Nurses Association asked ordinary citizens to just bring what they had to a collection place. And we actually, personally, my husband and I took literally a box where we had about 10 of them. And you would be amazed at how grateful the people were to receive just a box of 10, which, if we think about, is really not going to impact that many healthcare workers. But the fact that they were so grateful to receive that really emphasized to me that we must be reserving these kinds of masks for that population.
Absolutely. I see another question coming in around specific to a quarantine. So if a hotel were to quarantine affected people, what is the risk to the employees if infected people are isolated in those guest rooms?
So I'm assuming that this would be a quarantine where the hotel, likely directed by the public health authority, the state health department, for example, was asked to, basically not permit those guests to leave, and the guests were told to stay there, assuming they are actively sick. In this case, yeah, I'm supposing here, but assuming those patients or people who are asked to stay there are actively sick, there is potential for them to transmit that virus to staff. So I would certainly want to make sure and would recommend that employees stay away from those quarantined rooms. Obviously, this would mean not cleaning those rooms on a routine basis, but the risk to that employees' own health certainly is higher than the discomfort that I think a person in that room might experience. That said, there certainly needs to be ways to take care of the needs of the people in those rooms. And this is where I would be working with local public health authorities to determine how best to do that. They may, for example, choose to maybe make masks available in this situation, maybe providing other personal protective equipment. Maybe there are ways to again, take care of these needs by minimizing risk to the employees, but it would be a very, very specific situation. So working with the local health department would be important.
Great. And I know we're inching closer to the close of the webinar. I have maybe time for one or two more to squeak in here, and then any extra or questions we did not get to, we can always reach out to Ecolab representatives and they can help with that. But one of the questions that I've seen a couple of times now is around the possibility of becoming immune to the virus after recovering from it, or if it's possible to be reinfected with the virus.
Yeah, I think we're a little early in the epidemiology or study of the virus to really know definitively. I've seen some very anecdotal reports that there have been cases of apparent reinfection of people, but it is definitely not the norm. And I quoted those, I think, rather alarming statistics of numbers of cases right at the beginning of this webinar. But we also need to keep in mind that there are a tremendous number of people who have recovered from COVID-19 and have not become sick again. Certainly there have been some fatal outcomes, and I don't want to belittle those at all, because that's certainly very tragic. But the majority of people do recover from COVID-19, and whether it's due to their becoming so-called immune to the virus, or that they are frankly just practicing the social distancing and social isolation that we're in large part all being asked to do, I'm not sure we can tease that out quite yet.
Absolutely. There was a specific question, I think, related around the surfaces again. I think that was one of the first questions I asked around cardboard, because a lot of the gloves that are being leveraged by staff come in a cardboard box. So should they proactively be keeping gloves, masks in Ziploc bags, or is there alternatives for that?
At this point, again, if we go back to, yes, there is a theoretical potential of survival of the virus, but I went through the scenario of what reasonably would be required for such contamination to occur. I think the likelihood of transmission from these surfaces is very, very low. We can never say zero. And we have to step back on the fact as well that there really has not been evidence of transmission from these kinds of surfaces. So I don't know if I would go to the effort of transferring all of these kinds of items into different sorts of packaging, so to speak, because the risk is just very low. This is assuming that we are following these standard infection prevention practices, which again start out with hand hygiene and use of hand soap and water following the 20-second hand wash procedure that we're all supposed to be doing, maintaining our social distance, and following cleaning and disinfection of these high-touch surfaces, which could have been contaminated by an infectious person. If there is evidence that some of these containers in which these equipment or apparatus might be stored, if there's evidence of those being contaminated by someone who is sick, then cleaning or applying a disinfectant to that as is possible could be a reasonable step to follow. But I also have to think about just the realistic risk of that, and it's very, very low.
Absolutely. So there was one last question I think we can sneak in here around chemical dish machines. There was a comment around generally high temp machines are fine, but was there any specifics around low temp machines that may use chlorine to sanitize?
Yeah. Again, we haven't done a lot of study, but the recommendations from our public health authorities is that standard warewashing practices are fine. And I would still follow that. There's been not any evidence, again, of transmission of COVID-19 from any kind of wear. So, we can never say the risk is zero, because it never will be. But I think from a reasonable and practical standpoint, following those standard practices will be effective.
Great. And I lied. There was one that has come in a couple times around
No
delivery drivers. I'm so sorry. Just want to get this last one in here.
Sure.
Safety for delivery drivers that might be delivering critical supplies.
Sure.
And can we talk a little bit about that?
Yeah. I think if we just think practically and think about applying these standard sorts of infection prevention practices to what a typical delivery driver would be doing is key. Where is that driver going to come in contact with an infectious person or infectious material, trying to minimize their interaction with infectious people certainly is important. Making sure that they are practicing disinfection of the high touch point surfaces that they may come across. Their steering wheel, for example, after they come out of a facility, making sure that they are practicing effective hand hygiene as best they can, using good soap and water and so on makes sense. If there's a way that they can essentially minimize contact with other people, all the better. So if they can, say, place a delivery outside of a door and not have to even go in a facility, maybe phone ahead and let someone know that they're doing that so that they can drop the delivery, and then the person who's receiving that can come out after that driver walks away or drives away. Just kind of practical common sense things like that are what we need to be thinking about. It's hard to be very definitive because every situation is different here, but these may be some practical things.
Wonderful. Thank you so much, Ruth, for your time today and answering all these questions so thoughtfully. And thank you to all of our attendees for tuning in today. For any additional questions or maybe questions that we weren't able to address, I know there were a lot of them coming into the Q&A on the webinar today, please feel free to reach out to your Ecolab rep and they can help you with specific questions around procedures or concerns you may have. Thanks so much.